Have you ever experienced any trauma in your life, or perhaps some emotional stress, or maybe you have unexplained aches and pains? Maybe you've gone to the doctor and you've run tests, and the doctor comes back and says, we don't know what's wrong. There's nothing wrong. And you're like, there's something clearly wrong. So, what we're going to talk about today is we're going to dive deeper into correlations between specific types of emotions, more specifically, unhealed emotions, and specific types of symptoms that you might be experiencing that are showing up in your body. What are these specific symptoms, physical symptoms? What might they be communicating to you about these unhealed traumas or stress responses, stressful experiences that you've been through, or unhealed emotions? That's the second part. The third part is, what do you do with that information? So if you find through a lot of the information I'm going to present to you today, there's a handful of it. If you find some deeper awareness of, oh, maybe that's why I'm having this specific issue. Maybe this is why I'm having these recurring ulcers, or the right shoulder pain, or this injury to my hip or my hamstring, whatever it might be. What do you do with that information? So I'm going to show you an applicable way how to apply that information practically for self-healing, emotional healing. So I worked a lot with clients in the past as a trauma therapist, doing a lot of psychosomatic work with clients, recognizing the mind-body connection. And a lot of my clients that I've worked with in the past, they come to me for a couple of things. Some of them have come to me for specifically emotional pain, and there's all these physical symptoms that their body is experiencing, but we're not focused on that. We're focused on the emotional healing. When they experience the emotional healing, guess what happens? The physical symptoms start to improve, sometimes significantly, as a side effect of emotional healing. It's the number one most overlooked issue with physical symptomology is emotions. So, and as I began working with more and more people who were getting positive physical symptom results as a result of emotional healing, then I started getting more clients that would come to me with aches and pains and be like, hey, I don't know why I have this chronic back pain, but it's been bothering me for years. Is that something you could help me with? And when we dive deeper, 9 times out of 10, this is not 100%, but 9 times out of 10, approximately, there usually is an emotional component to the physical pain. It may not be the number one sole thing, but I've also seen a number of times where it is. It is the number one sole thing in a number of cases as well. So my hope for you is that you walk away from this video with more information, more insight into how your emotions or your emotional experiences from your past may be impacting these physical symptoms that you're currently experiencing. And then thirdly, giving you some tools and strategies for self-healing to be able to move some of those emotions out of the body. So let's get into it. What is your body trying to tell you? What is it communicating through these physical symptoms? So one of the premises that you may have heard of is the issues are in the tissues. And I think this illustration demonstrates that. The issues, the emotional issues, more specifically, the unresolved emotional issues, literally reside within your tissues. So your emotions are physiological. And so they are actually these tiny little information substances known as neuropeptides, and they can go to all different parts of your body. And if they are left unchecked over time, they create imbalances in the body, and over time they can actually manifest as physical pain, and perhaps even over a longer duration of time it can actually manifest as a chronic conditions. The beautiful part of having that information is that we can reverse that. So I've actually even worked with people that have had chronic issues like fibromyalgia, for example, or chronic pain, whether that's in their back or their neck or their knees or whatever it is. And it begins to reverse as we look at those psychosomatic mind-body connections and begin to heal the emotions. It is so very common. So what is your body trying to tell you? So my hope is that you'll have a lot more information by the end of this video and give you some more insight as to what is actually happening in your own personal body and how that relates to things that you've experienced in your past, and not just intellectually knowing the knowledge, but knowing, okay, now this is something that I can practically do to begin to feel better in your mind and your body. So the issues hold trauma. A common book, I'm actually going to fast forward one slide. One of the most common best-selling books on this topic is The Body Keeps the Score. You see it here. There's a number of other books that talk about how these things happen in your body, where the issues are in the tissues. This book here, When the Body Says No, this is a really great book by Dr. Mate, if that's how you pronounce his name, Dr. Mate. He's fantastic. I really, really enjoyed that book. The Body Keeps the Score, #1 bestseller, I believe, if I'm not mistaken. And any book by Dr. John Sarno. He does a lot of work on psychosomatics, the mind-body connection. So this book, The Mind-Body Prescription, The Divided Mind, The Epidemic of Mind-Body Disorders, Healing Back Pain, The Mind-Body Connection. Check any of those books out if you'd like to learn some more and dive deeper onto this topic. But all these topics talk about this concept of how, aches and pains, the physical symptoms that show up in your body that you can actually feel physically, and sometimes you can even see these things depending on how they manifest. Those are, let's use the iceberg model here for a moment. Those are the issues that are above the surface. These are the things that you're consciously aware of them, right? It's not like when you feel physical pain, you feel it. You're like, okay, my elbow really hurts. This is really annoying. Aches and pains in physical symptoms are the things that we can physically, we're consciously aware of, right? When you go below the surface though, in this diagram of the iceberg, that's where our emotional wounds are. Perhaps previous traumas that we've experienced. Sometimes deeply below the surface. And so we're going to talk a little bit more about that correlation of how these unchecked or unhealed, I should say, unhealed emotional wounds and previous traumas can manifest as physical aches and pains and chronic conditions. So again, these are just some resources. There's a lot of other books out there, but I wanted to give you a handful if you want to dive deeper on this topic. Pain is the most common symptom reported to healthcare providers. Surprise, surprise. That's not a surprise, probably to most of you, right? The difficult part though, a lot of my clients that I've spoken with is like, they've gone to doctor after doctor, maybe even specialist, and sometimes they're still left with a bunch of question marks. All the test results come back normal, and they're still actually feeling physical pain and aches and things that are maybe unresolved. And that's kind of a really hopeless feeling for a lot of my clients. They talked about going to all these different doctors and still having so many questions and nobody having the answer. Now, again, this is not, when I'm talking about emotions playing a role in that, that's not 100% the case. I'm not saying it's always the case, but I am saying it is often the case that unresolved emotions may be influencing those symptoms and or perhaps even causing those symptoms. So there's a significant correlation, a connection between the emotional stress and physical pain. What are some examples of emotional pain that contributes to physical pain, or emotional contributing factors to physical pain? So here are some of the top ones. Adverse childhood experiences, also known as ACEs. So if you're not familiar with the ACEs study, I could do a whole other talk on that, and please leave it in the comments below if you'd like to learn more about that. I've showed up on podcasts talking about this. It's really, really significant, actually. There's a large study of around 17,000 people that was conducted by Kaiser, and I believe it was the CDC. And they followed, a large number of people throughout a duration of time and found that the more ACEs, adverse childhood experiences, that they've had in childhood, the higher probability, the more likely they were going to experience specific physical things such as cardiovascular disease and even mental health issues such as suicidality, depression, anxiety, things like that. And they can actually, even show how likely you are, how many more times you are probable the likelihood of you probably going to, experience this based on how many adverse childhood experiences you've had. Now, what are adverse childhood experiences? Again, I could do a whole other talk on that, but it's basically the quiz that you can take online is a 10-question quiz. So there's very specific things that you may have experienced in your childhood, which are known as ACEs. So that's a big contributing factor that can later lead to unresolved physical pain. Okay, so ACEs, adverse childhood experiences. Even adult exposure. So it doesn't necessarily have to have only happened in your childhood. What if you had exposure to traumatic events anytime in your life, including accidents, bad car wrecks, whether you were personally involved or even you witnessed it. Even just witnessing it can cause a lot of trauma symptoms. Experiencing a natural disaster, rape, violence, the list goes on and on of different things you may have been exposed to in your adult life. Previous or current events or experiences that left an emotional wound. Perhaps a breakup, someone you really loved, really cared about, and the relationship ended. That can cause a lot of emotional wounds that are still left in the body, residing in the body, that over time can contribute to these symptoms. And sometimes it doesn't even take a lot of time. Sometimes these physical symptoms start popping up just like that. So loss of a loved one, loss of a job, anything that causes an emotional wound, emotional hurt and pain can contribute to physical pain. So the key is getting the issues out of the tissues. Healing the emotions, basically, in a nutshell. The key is to heal those emotions. And again, I'm going to get to that towards the end of this video on some practical ways that you can begin to heal some of these emotions, which hopefully can begin to reverse some of those physical symptoms. So, did you know in Chinese medicine, if you've been around a Chinese medicine practitioner or perhaps an acupuncturist or, just maybe any kind of practitioner that looks at the mind-body connection, did you know that all of our major organs and glands in our body have specific emotional correlations? In other words, let's look at the liver here, for example. The liver and the gallbladder, those are often associated with feelings such as anger, frustration, resentment, irritability, any of those types of emotions, rage, all of those emotions that are anger related, those can have a negative impact on your liver and your gallbladder. As well as, we're going to get into this in a moment, we're going to go through all of these. We're going to talk about even specific muscle groups that it might impact. And what are those emotions, if those are left unchecked over time, what kind of impact do they have on your mind and your body? So we're going to bring in Chinese medicine, which has been around for thousands of years. And I'm going to share a lot of these things with you to provide more awareness and insight. So get some paper out. I highly recommend getting a notebook out, sheet of paper, a pen, pencil, whatever, and start taking some notes as we go through these next slides. So for these next 13 specific slides, I want you to just jot down, if you've experienced in the past, or maybe even currently, any of the following physical symptoms and or the correlating emotions. Okay, make a note of that. It's going to be helpful for you. So here we go. Stomach. The stomach, the organ of our stomach, has what's called meridians. All of our organs and glands have what's called meridians. Let me talk about meridians for just a moment before I get into the information on the slide. Meridians are a channel, a river, like a river of energy, both on the right side of the body and the left side of the body. So the stomach has a certain pathway, meridian, on the right side and the left side. Think of it as a river of energy that allows your life force energy to flow, your chi. It allows that life force to flow through the body. We want that, right? What happens if we have unresolved emotions? They can actually make those meridians sluggish. So if you think of a body of water like a river, a nice rushing flowing river, and all of a sudden it starts to get stagnant. because there's all of these things, infesting the river and just making it sluggish. That's what can happen when we have these unresolved emotions. Why do I bring up meridians? I want to mention here the stomach meridian, those energetic lines of energy, it regenerates in a 24-hour cycle. It regenerates between 7 a.m. and 9 a.m. Okay, 7 a.m. and 9 a.m. Here's another thing to pay attention to. If you notice yourself having a specific symptom that tends to show up at a specific time of the day, I want you to think about that too, jot it down. Okay, 7 and 9 a.m. Stomach is, meridian is regenerating. What impacts potentially the stomach? What are the emotions that can impact the stomach and or these specific muscle groups? So what are the muscle groups? Let's take a look. This muscle group, the pectoralis major clavicular, right there, you see it there in the image. If you've had any tears or issues with that, it could potentially be an unresolved emotion. And we're going to get to these emotions in just a moment. Brachioradialis, those muscle groups there, the neck flexors, these are all related to the stomach meridian, and emotions. Here's some of the symptoms that might be correlated. So do you have any of these symptoms? Acid reflux, bloating and gas. Now, and I'm not talking about like a one-off thing. We all experience that from time to time, right? I'm talking about things that generally tend to be recurring. Okay, so acid reflux, bloating and gas, diarrhea or constipation, discomfort in the shoulder or the neck, discomfort in the elbow or the wrist, or ulcers. Here are the correlating emotions. If you ever experience any of these symptoms, any injuries to these muscle groups, any tears, any sprains, or any of these specific physical symptoms, I want you to ask yourself this question. Do any of these emotions stand out in your mind? Is there something that you've experienced 2 months ago, 2 years ago, 20 years ago that you sense? You might have a gut sense. As I'm going through these things, you might feel a little sucker punch to the gut once in a while. That's your intuition talking with you. I want you to pay attention to that. Here are some of the emotions: feeling anxious, feeling disgusted, feeling egotistic, helpless, hopeless, nervous, feeling a lack of control. Something happened that was outside of your control. You could not do anything to control it. Low self-esteem, feeling obsessive about something, feeling overwhelmed, feeling powerless, feeling worthless. Those are some of the top emotions that can negatively impact, if left unchecked and unhealed, they can negatively impact the stomach. They can cause symptomology, oftentimes more so between 7 and 9 a.m. Not always, but if something is popping up between 7 a.m., think about that. There might be a correlation. Any of these muscle groups or any of these physical symptoms. Okay. Why is this slide yellow? I color coded these because in Chinese medicine, there tends to be an element that these are associated with. So stomach is associated with the earth element and is often yellow. Okay, that's why. All right, so here's an example. I mentioned the meridian, right? So I didn't put the meridians on here for every single organ and gland, but I just want to give you an idea of what this kind of sort of looks like. This is a picture of the meridian channel for the stomach. Now, this is only showing the meridian on one side of the body. Imagine it being mirrored exactly the same on the opposite side of the body. That's exactly what's happening in our body. We have one on the left and one on the right. Okay, so this one is showing on this person's right side of the body, it's showing where the meridian channel is for the stomach. Now, sometimes you might notice that symptoms appear along that energetic channel that can also be a correlation for unresolved emotion. So for example, if you look closely, one of the toes, I can't tell actually which one it is. Is it the middle toe? I think it might be the middle toe. I'll have to take a closer look. I don't have all the meridian energetic channels memorized in my mind. A Chinese medicine practitioner probably would, an acupuncturist definitely would. But let's just imagine if this meridian channel for stomach, if it comes out the middle toe, for example, if you have issues with your middle toe, as an example, it might be an indication of unresolved emotions. that are related, that are in this field, in this category: anxious, disgust, helpless, hopeless, nervous, things like that. Okay. All right, moving on. We're gonna go through the 24-hour cycle. So now we're moving on to 9 a.m. to 11 a.m. What's regenerating? The spleen and the spleen meridian. What are the muscle groups that are associated with the spleen? The lower traps. What are some symptoms that you might be experiencing that are indicative of either an unhappy spleen or, more specifically, unresolved emotions in this category? Now notice the emotions are the same as the stomach. The stomach and the spleen are kind of like cousins. They're both yellow. They're both earth elements. You can just imagine them kind of being like cousins. Symptoms you might experience: anemia, discomfort in the left shoulder specifically, or the mid back specifically, dizziness, excessive bleeding, fatigue or headaches, lowered immunity, pain in your upper left abdomen. This is very specific. It's not just any part of your abdomen, it's your upper left abdomen. Recurring infections. Those are very common symptoms that are indicative of unresolved emotions. These specific unresolved emotions, the same as the stomach emotions, that can impact your spleen, have a negative impact on your spleen and or lower traps. Okay. Jot these down. If you're noticing any of these symptoms, jot down, let's say, for example, you've had, a lot of dizziness lately, hypothetically. Okay. Look over on the emotions chart and jot down which emotions really stand out to you. There might be a time in your life where you're like, you know what? I know exactly what that is. It was when I was 9 years old. I felt a lack of control. I was powerless. That's what did me in. Or, maybe that's what, so you're like, this is a trauma or, a really stressful event that happened in my life. I want you to jot that down. Okay. 11 a.m. to 1 p.m. What's regenerating? The heart, your heart and the heart meridians. Subscapularis, under your shoulder blade. That is the muscle group that is associated with your heart. Symptoms that you might be experiencing: difficulty giving or receiving love. Giving or receiving love, difficulty with that. Discomfort in the chest or the shoulders. Heart palpitations, skipped heartbeat, low energy. Those could potentially be symptoms that are showing, hey, do you have any unresolved emotions in this category? Abandoned, feeling deserted, feeling fragile, insecure, left out, manic, rejected, unloved, unsafe, unwanted. Do any of those emotions resonate? Jot those down. What's next? Small intestine. Now we're moving into, this is the fire category. These are red. It's associated with the fire element in Chinese medicine. Small intestine is regenerating between 1 and 3 p.m. The meridians are regenerating as well. What does it impact? The abdominals, the abdominal muscle groups, your quadriceps, your thighs, at the top of the legs there. Symptoms that you might experience: bloating and gas, diarrhea. Now you notice some of these showing up in the previous slides, right? So some of these overlap. There's not like one specific pathway for every single thing. Bloating and gas, diarrhea, lack of nutrients, nausea, pain in the knees, specifically pain in the lower back, specifically skin problems. Those may be indicating that you have unresolved emotions in the fire category: abandoned, deserted, fragile, insecure, left out, manic, rejected, unloved, unsafe, unwanted. If any of those emotions ring a bell for you, jot those down. And if any of those symptoms or even muscle groups, if you're having, any kind of injuries or issues with these muscle groups, jot that down. All right, moving on. Now we're moving into the water element. So the slide is blue because now we're moving into water element. The bladder, the meridian bladder is regenerating between 3 to 5 p.m. Do you have any symptoms that keep popping up between 3 and 5 p.m.? Jot this down. So these muscles right here, right near the spine, it can impact those specific muscles, as well as the tibialis anterior. So these muscle groups right on the top of the shin area. These are the symptoms: bedwetting, incontinence, discomfort in the knee, ankle, or foot, discomfort in the lower back, frequent urination, meaning more than usual, infection, interrupted sleep due to urination. These could be indicative of unresolved emotions such as feeling afraid, feeling dread, feeling fearful, frightened, horrified, hypervigilant, panic, paralyzed, scared, shocked, terrified, timid. Now, there are more emotions in this category than are listed. So if there's an emotion that you can think of that's very similar to afraid or, terrified, most likely it's going to be in this category, in the water category. Okay, so do any of these ring a bell for you? Moving on to the bladder's cousin, the kidneys. The kidneys are regenerating between 5 p.m. and 7 p.m. These are the muscle groups that are correlated: the upper traps, the psoas, or your hip flexors. I know a lot of people that have hip flexor issues that can also, the hip tends to be, the hip area, and more specifically the hip flexors, tend to hold on to stress and trauma. It's almost as if we're, when we're kind of embracing for something bad happening, the hip flexors can kind of tighten up. Again, same emotions as we just listed for the bladder, those fearful types of emotions. What are more specific symptoms that can often influence the kidneys or these muscle groups? Discomfort in the lower back or mid back, discomfort in the lower rib areas, fatigue, a foul taste or a metallic taste in your mouth, pain in your legs, swelling in your ankles or your face, or TMJ. That's where I don't remember exactly what TMJ stands for exactly. It has to do with your jaw. So if you, if your jaw gets really tired a lot, you might have TMJ. So these are some things to pay attention to. Moving on, 7 to 9 p.m. What is regenerating? Your sex organs. So the uterus, the prostate, the muscle groups that are influenced are your glute muscles, your butt, your adductors. These are the muscle groups that are impacted when something is, off in your sex organs. And more specifically, again, 9 times out of 10, if there's something off in the muscles or the organs, 9 times out of 10, or even these symptoms, 9 times out of 10, it's because there are unresolved emotions. It's like the iceberg model that I showed you earlier. The aches and pains are what you see above the surface, but if you go below, deeper, what is causing that pain? It's usually these unresolved emotions. So feeling ashamed, feeling awkward, feeling bashful, feeling bullied, feeling dishonored, embarrassed, guilty, humiliated, mortified, self-conscious. What are the symptoms? Decreased urine flow in men, specifically, discomfort during or after intercourse, specifically for women, discomfort in the lower back, infertility or being sterile, pain in the left hip, specifically, not the right hip, just the left hip. Okay, those are correlations with these specific unresolved emotions. Moving on, we're still in the fire category. Thyroid and adrenals are regenerating between 9 p.m. and 11 p.m. These are the muscle groups, that tiny little muscle there near you see it there in the picture. Gastrocnemius, your calf muscles, your sartorius, gracilis, that muscle that comes along on the inside of your, like the inside of your thighs. Symptoms of an overactive thyroid can include hair loss, nervousness, or a rapid heart rate. In underactive thyroid, the symptoms could include cold intolerance, not being able to tolerate cold very easily, feeling fatigued, feeling weight gain, or not feeling weight gain, actually having weight gain. Your adrenals, some of the things that impact adrenal function, when the adrenals are not happy, so to speak, it can cause brain fog, difficulty handling stress, Fatigue comes up a lot in these different categories. Joint noise, noises in your joints. Pain in the left knee or the low back. Symptoms again, ashamed, awkward, bashful, bullied, dishonored, embarrassed, feeling guilty about something or humiliated or mortified or feeling self-conscious. So if you have any of these unresolved emotions, they could potentially be contributing to these symptoms or, pain or issues with these muscle groups or the thyroid or adrenals. Moving on, 11 p.m. to 1 a.m. Now we are in the wood category, which is associated with the color green. The gallbladder, anterior deltoids. So that front part of your shoulder, your anterior deltoids. The popliteus, which is the back of the right knee. The popliteus, back of the right knee. They're correlated with the gallbladder. Emotions are anger, defensive, frustrated, feeling furious, hateful, impatient, irritated, jealous, judgmental, feeling rage, resentful, stubborn. These are all emotions related to the category of wood. More specifically, we're talking about the gallbladder between 11 p.m. and 1 a.m. Symptoms might include bloating and gas, discomfort in the right knee or the right shoulder, nausea, pain under your right rib cage, or vomiting. Now again, 11 p.m. to 1 a.m. Now, oftentimes when I'm meeting with clients, I will be asking them specific questions about when they're experiencing physical symptoms. Here's the common one. I wake up at 2:30 every morning. I don't know. I'm not sure why. What's regenerating at 2:30? Between 1 a.m. and 3 a.m. is the liver. Okay, the liver meridian is regenerating between 1 a.m. and 3 a.m. Oftentimes, what I've noticed with clients, if they're waking up between 1 and 3 a.m. and it's recurring, it is very common that they have an unresolved emotion, something in the anger category, right? Feeling angry about something, resentful about something. It's just kind of eating them up and it's waking them up when these meridians are regenerating. So it's really interesting to just notice these correlations. What does this impact? The liver is associated with these specific muscle groups. So the pectoralis major, just basically in the chest area, and the right rhomboid. So kind of back below, behind your shoulder blade there, in the middle, on the right side, your right rhomboid muscle is associated with your liver. What are some of the symptoms? Discomfort between your shoulder blades, discomfort in the right shoulder specifically, headaches, loss of appetite, weight loss, swelling under the right lower ribs, or yellowish eyes or yellowish skin. That can be indicative of an unhappy liver, or more specifically, unresolved emotions in this category. So all of these anger types of emotions. If we have a lot of that, or even just a little bit that keeps growing over time, it's almost like a poison, right? And it can actually cause these symptoms and interfere with the function of these muscle groups. I mean, I'm telling you, it's so fascinating how, even just doing some weight training exercises and you notice, wow, why is this hurting so much? Or why is this muscle so weak and all my other muscles are strong? There might be a correlation. You might actually have better function even in your strength training, for example, when you begin to heal these emotions. And I have a personal example of that I'll share in a moment when it's related to one of these. I'll share it in a moment. The lungs, 3 a.m. to 5 a.m. is when the lungs are regenerating. That's also associated with the deltoid, shoulder muscles, and the sides of the chest here. Symptoms, a persistent cough, a cough that just doesn't go away. It's just persisting. Asthma, discomfort in the ribs or your upper back, pain or discomfort when you're breathing. So any kind of respiratory issues, having shortness of breath. These are the specific emotions that might be impacting you. Despair, feeling devastated, feeling dogmatic. It's almost like you dig your heels in and you're like, I want it my way. It's got to be my way. Grief, heartbroken, feeling lonely, feeling perfectionistic, feeling regretful or sad or sorrowful, tearful, or yearning for something to be different. So any of those emotions, if any of those ring a bell, and you might be experiencing some of those symptoms or issues with these muscle groups, could be a correlation. So moving on to 5 a.m. to 7 a.m., the large intestine. Hamstrings, the tensor fascia lata. Did I pronounce that correctly? I'm not sure. Hamstrings. Here are some of the symptoms. You might have bloody or tarry stools, a change in frequency in your bowel movements, perhaps diarrhea or constipation or even colitis, discomfort in the hips, discomfort in the low back, and perhaps even mucus in the stools. And again, same emotions as the previous slide. So we're just talking about the lungs. Now we're talking about the cousin, the large intestine. This is in the metal element, which is why this slide is white. White or gray are often the colors for the metal category in Chinese medicine. Are any of these emotions, something that you've experienced that might be influencing these muscle groups? Now here's where I'm going to share a personal example. Hamstrings. Okay, I was training at a strength gym. I was training for a powerlifting competition, and going 3 times a week, training for an hour and a half to 2 hours, building my strength over time. And one particular day, nothing out of the ordinary, I go to the gym and I get ready to do my deadlift. And this is a weight. I don't remember exactly what the weight was specifically in my mind. This was a few years ago. But I remember going to do the deadlift, which I've done a million times before. And I could not lift the bar. My right hamstring was so painful. And there's nothing specific that I did to injure my hamstring. I just went to go lift, do my deadlift in my training, and I couldn't lift it. So my coach was like, okay, take some weight off. So I took some weight off, couldn't deadlift it. Took a significant amount of weight off the bar. I still could not deadlift it. I was like, what is going on? Like, I mean, this is like baby weights to me at this point. I'm like, I can't even lift the baby weights now. Come on. And I remember I got so frustrated with myself. Even my coach was a little frustrated, like, what the hell is your problem? Kind of thing. It's just like, Lori, what is your problem? I'm like, I don't know. I don't know what the issue is. I go home and I start having this like internal dialogue with myself. I'm thinking to myself, okay, if my client came to me and said, the scenario, this happened to them, what are the questions that I would ask my client? What are the correlations I might notice as a practitioner? And so I started thinking about it as like hamstrings. Hamstrings are associated with feelings of grief. Boom. Immediately, I was able to correlate it with something I was actually grieving. Grief is a tricky one. Grief comes in waves. If you've ever had any kind of loss, there are certain things that will really trigger grief, even if it's been years, anniversaries being one of them. So there was an anniversary of a loss that I had, and it was right around that time frame. It was within like a 3-day window. So I knew that was part of it, because right when I thought of it, I instantly started crying. I let myself cry. I had a really good cry. I woke up the next day, and when I was walking around, I noticed a very noticeable difference in my hamstring. I was like, my hamstring is not sore anymore. It feels amazing. It feels so much better. I went to the gym the next day, and I was able to deadlift that same exact weight that just took me out 2 days prior. I was able to lift it no problem. The issues are in the tissues. Now, I'm not saying that is the same, that's the case for everyone all the time. It is very common. So I go back to the gym, I lift the weight, and my coach was like, what did you do? And I told her, I was like, you're going to think I'm a little bit crazy. But I kind of, gave her a little bit of the background of, I really, doing a lot of research on psychosomatics and the issues in the tissue. I had a good cry. It was related to the grief, blah, blah, blah. And she looks at me kind of like, are you serious? And so we just had a running joke, because I think months later, I was struggling with my squat, and, I was training for another powerlifting competition. I was struggling with my squat, and she's like, puts her hand on her hip. She's like, do you need to have a good cry? I was like, you know what? I might need to have a good cry. So it's amazing. It is amazing how these unresolved emotions that, are in our tissues, how they can really manifest in get in the way of us feeling our best. So that's just I can give you a lot of different personal stories, but that's just one that comes to mind when we're talking about hamstrings here specifically. So, okay, we just went through a lot of slides. So hopefully you've taken some notes, jotted some things down. If you need some reference, if you need a quick PDF handout, I'm going to leave it in the description below. This is something you can pick up in it's what's called Stand Store. And the PDF download, I think it says, "What is your body communicating?" It's a free guide. So if you want this for reference, it's a quick sneak peek of all the slides that we just went through, looking at what are the specific symptoms that we talked about in the slides and what are some of the correlating emotions. Okay, so if you want that PDF, just go to the link in my description and you can download that for reference. You could print it out or just, screenshot it, whatever. So these are, different ways that your body might be communicating stuck emotions. Here's my number one hope for you guys. And again, I've worked with so many clients that have had, pretty significant issues in, physical pain that can be really debilitating at times. I want to encourage you guys, if you are, especially if you're in a situation where it feels hopeless, I want to encourage you that there really is hope for healing, especially if there is an emotional component. And again, I'm not saying 100% of the time it is, but it is so very common. So very common. I had a client one time that came to me because she had all this jaw pain for years, and it was so debilitating. She tried massaging, she went to a special dentist, she did all these different, exercises, she did guided visualizations, she changed her diet, she did all these things. Well, it turns out when we're working together within just 3 sessions, we were able to identify that there actually was still unresolved emotions from her previous marriage that she thought she worked out. I thought I was over that. Well, her body was still holding on to those emotions. So when we worked together to process those emotions, guess what happened? Her jaw pain went away. I can give you so many stories about even chronic things that began to reverse as a result of healing the emotions. Now, I'm going to show you now how you can actually use this information and use a practical way that you can begin to heal yourself. Now, if you're finding that you're not able to really get deep down below the iceberg, I do work one-on-one with clients around the world. So you're welcome to book a consultation call if you want to dive deeper and work with someone that's trained professional that can help you dig deeper and resolve those emotions. You're welcome to book a consultation call with me. I'll leave that link in the description as well. But here is something that you can do on your own that can begin to help to heal those emotions. So I'm going to leave this link below as well. My number one stress tool, it's called the Pulse Point Stress Tool. Enter your email, you'll get the video demonstration on how to use this tool. What I recommend for your practical application is spend at least 10 minutes journaling about possible times in your life that elicited difficult emotions. Okay, so think about those different life events that were pretty painful. Jot down the emotions that you recall from those life events. And then use the Pulse Point Stress Tool. It's a very simple, very helpful, gentle, effective way to begin to move the emotions out of the body, get the issues out of the tissues, begin to neutralize those emotions where you're not going to forget what happened. We don't necessarily forget what happened unless it's a trauma response. That could happen. But for most of us, we can still recall the events and even the traumas that have happened in our past, but we don't want our bodies to get hijacked by re-experiencing those same emotions over and over again as if we're experiencing it again and again and again. That puts so much weight, mental, emotional weight on our minds and our bodies. This Pulse Point Stress Tool is going to help to get some of that weight off your mind and your body, help to change the physiology of those emotions, neutralize them so that you can still recall things in your past, but without the emotional charge. Okay, so I highly recommend doing that. The other thing you can use the Pulse Point Stress Tool for is going back through all the slides that we just went through. If you notice that you jotted down some of the physical symptoms they might be experiencing and possible correlating emotions, you can use a pulse point stress tool to process those specific emotions as well. And you might have to do a little bit of dialogue, inquiry for yourself. Like, let's say, for example, you wrote down the emotion of vulnerable that was related to, a specific physical symptom that you experienced. You might have to do a little bit of inquiry, like, when did I feel really vulnerable? And maybe it was multiple times in your life that come to mind. And by the way, you don't have to put pressure on yourself to do all of this in one sitting. Maybe give yourself like 5 to 10 minutes a day, or maybe even just do it once a week, whatever works for you, giving yourself some time and space over time to process some of these emotions. Emotions happen to the best of us. In other words, like heaviness, stress happens. It is unavoidable. The things that we've experienced in our lives, some of the deeply painful things, we can't avoid that. It's part of being human. And I think one of the things that the number one thing that my clients say when they come to me for the first time is, I feel stuck. I know I can write down all of the things that happened to me. I can list all of those things down. I can even tell you the emotions. I can tell you all the details, but I don't know how to feel better. And I'm happy to even do another talk create another video on the science of how that works. If you guys are interested in that, leave your comments below. Any questions that you have or comments about this video, please leave your comments below. And I'm also curious, like, what are your top takeaways from this video? Is there anything specific that stood out? Like maybe, you're like, oh, wow. Maybe that's why I'm having all those issues with my traps, because of, that symptom and that emotion. I'd love to hear your comments below. And like I said, let me know if you have any questions. And if you are feeling stuck in any way, shape, or form, and you want to dive deeper, you can book a consultation call with me. I work one-on-one with people all across the globe. I use very fast, deep working techniques that it's like we go deep sea diving. The image of the iceberg, we go deep at your own pace, of course, but we get those root causes up and out of the system. Very different than talk therapy, okay? I am a licensed clinical counselor, but I'm not doing therapy with people. I'm doing very specific techniques that work on the mind and the body to reduce stress and even heal trauma. Somatically, looking at the psychosomatic mind-body connection and using techniques that work on the deeper part of your brain. When we show up to, talk therapy or working with a life coach or whatever, 9 times out of 10, we are just using our conscious thinking brain, the prefrontal cortex. The mammalian brain, the emotional part of our brain, the subconscious, that's a whole different animal. So the key of creating a lasting change in your emotions and your mind and your body, even your behaviors, is getting to those deeper things in the deeper part of your brain. So I use evidence-based, super solid techniques to do that. But this technique right here, using the pulse point stress tool, again, it is such an amazing self-help, self-healing tool. I highly recommend utilizing that and adding that to your arsenal of self-healing tools. Okay, we got through it. There's a lot there. If you guys want to, if you're curious to know anything, like dive deeper on any of these topics as well, let me know. I'd love to hear your thoughts, your comments. I am passionate about empowering people with knowledge and insight and practical tools that can help you feel better fast. So thanks again for joining me here today. And if you have any questions, comments, please leave them below. I'm happy to answer if I can. Have a great day, everyone.